right, so this is another episode of Off the Cuff. I am Dr. Minter.
And I'm Nurse Bryan.
We want to welcome you to another edition of Correctional Nursing. So we're going to tell you all the ins and outs of correctional nursing. So we thought today that we would talk about night shift, because we both work night shift. And I worked night shift last night, so I'm running on a couple hours of sleep.
Oh, that's rough.
Yeah. Well, last time you worked night shift.
I did.
Yeah. So you'll have to tell your story about how you went up on night shift.
Oh boy. Okay. So I ended up on night shift after working on day shift for about a year and a half. Basically, in jail. Basically what happened was they had where I work, a bid system. So you bid for your shift. There's 4 shifts. There's 2 on days and there's 2 on nights. And basically I got the bad draw. And they put me on night shift against my will. So I went to night shift, and it was rough. The first 6 months were the hardest. And I remember around month 5 being like, okay, well, they said give it 6 months and I'll be all right. And at month 5, I was still dying. I mean, I would get off shift and I felt like I had the flu. So I'd be driving home like, how am I going to get these kids to school? Like, how am I going to do this? This is so rough. And then around month 6 is when I finally started to feel okay. Like my body got adjusted and I can do it. But it was rough. It was very rough. And it still is at times. I never know when I get off in the morning if I'm going to feel like I've got the flu or if I'm going to feel okay to get these kids off to school. So it's hard to juggle, your daily life, your personal life with working night shift as a nurse. How did you end up on nights?
I graduated in 1990. And so back then they had this, what was then a huge differential, which was $5 an hour.
Oh, that's nice.
Well, it was, RN started at $15 an hour back then. If you can believe. Right. Well, that's 33 years ago.
Yeah.
So if you work night shift, they would give you $20 an hour. I was like, okay, I'll take night shift. So, but I was only 24 then, and I didn't have any kids. So I wound up on night shift then. And then I wound up in the military. So to survive the military and not wind up in Leavenworth, because I was always in trouble. Always in trouble.
Oh.
Every day I walked in, I had a letter of counseling. It was just, I had a target on my back. Plus, I just couldn't take orders without questioning, why are we doing this? This doesn't make any sense, whatever else. So I went to night shift to survive. So I wasn't in military jail. So I stayed for the 5 years. I stayed on night shift, and then I stayed on night shift after I got out for a couple of years. And then I went to day shift and had a normal life when my kids were younger. And then I was offered a supervisor job where I was 2 night shifts off like Friday and then 2 day shifts. And that was brutal.
Gosh, how does your body adjust to that,
Well, it didn't.
Yeah.
So, and my kids were probably your kids' age, because your kids are a lot younger. Yeah. So I would drive home, and I just can't believe I was doing this. So I had a bunch of little kids. I never slept, and talk about what can go wrong on night shift, after night shift, really. And I would drive, it was about like maybe a 45-minute drive, and I'd be driving, and there was this one light that was really long, and I had to make a left-hand turn, and I was like, oh, that light's turning red. Oh, thank God, I can take a nap at the red light, 4-lane road. I was like, oh. And then the car behind me would honk their horn. I'm like, oh, it's time to go because I'm getting honked at, right? So, and I don't know, I have no recollection of what I did with the kids or anything. I have a few, because there was a few issues. I was laying on the couch one day, and I had a set of twins that were 3. I'm laying on the couch after a night shift. When you don't hear anything with little kids, that's a problem.
It's bad. They're doing something bad.
Right. And I didn't hear anything. And then I heard, plug it in. And I'm like, plug it in. I'm like, boys. And then I don't hear anything. Boys. And I hear, what? And I said, what are you doing? And they're like, nothing. And I'm like, and I came out and they had it plugged in the iron.
Oh, yeah. That's rough.
Yeah.
Dangerous. It could have been bad if you didn't hear, plug it in.
You plug it in. And then one day, way back when, so it was the same job. And again, the boys were young. And I had, one of my girls was older. She was like maybe 10. She wasn't real old. And but I was really tired. I probably slept at the light again. And I got home, and none of the kids were up for some reason. Like, there wasn't anybody there. And then my husband at the time, he had must have just left. I must have had, like, he didn't see me or anything. I don't remember. Rachel was just enough to stay home for, a few minutes or something. So nobody was up. So I came home and I went to bed. And so my husband called the house, and he got the 3-year-old, and he said, is your mother home? And he said, Mommy not home. And he's like, she's not home? It's like an hour later that I should have been home. And he's like, are you sure she's not home? And he says, no, Mommy not home. So he calls up and gets the senior supervisor at the hospital, but she had relieved me. But she, at the time, we had this bed meeting, which was all the heads of all the charge nurses, all the heads of departments, and it was twice a day. It was 1 in the morning and 1 at night. So he calls around 9:30 in the morning at the bed meeting. Everybody's there. Phone rings. The supervisor picks it up, and he says, she never came home, blah, blah, but now I'm in bed. And she's like, what? She never got home? The whole hospital hears that in like 5 seconds.
Oh, and they're freaking out, I'm sure.
Yeah, right? So everybody thinks like I'm in an accident, whatever, call the police, whatever else. So anyway, somebody finally, I don't know if he called, and finally got a kid that made sense. So he finally got my daughter, so she had finally gotten up. And he's like, is your mother home? And she's like, yeah, our car's out front. So anyway, I'm like, why would you get the 3-year-old?
Yeah.
Right? Mommy no home. So I go in that night, and everybody thought I was dead. They're like crying and everything. I'm in bed. I was completely oblivious to the whole thing.
Oh my gosh, that's funny. That's great.
Yeah.
I remember I had a friend working night shift with me, and she's like, you're gonna it's gonna happen where you miss getting your kids from school. And I was like, no, that's not me. I'm a light sleeper. Like, I always, get up when my alarm goes off. I don't have to even set like multiple alarms. I've never been that way. So one day I'm sleeping, and my phone vibrates, and I roll over, and I'm like, ugh. And I like, just so happen to look up, and I'm like, huh? And it's a area code number that I'm familiar with. So I'm like, well, it could be the kid's school. So I answer the phone, and I'm like, hello. And on the other end is this really nice lady, and she's like, hi, we were just wondering, are you going to get Dawson from school today? And I was like, and I get off my ear, and I look, and I'm like, oh my gosh. I'm like, and it's way past when school gets out, way past. So I, put my bra on, I go out, get in the car, drive to his school, which takes a minute. I get there, and I'm walking up to get him because the teacher's up there at the front of the school with him. So I park my car, I walk up, and I grab him. I'm like, I'm so sorry. I'm just adjusting to night shift. It's hard. It's rough. And this is when I had just started night shift. Maybe I was a month or 2 into it. So I grabbed Dawson's hand, and we're walking back to the car, and I'm like, why do I feel a breeze in my crotch area? And I'm like, what's going on here? I look down, and I'm wearing my husband's boxers with no underwear on. So it's just a breeze going right through me, and I'm like, oh my God. I'm like, who does this happen to me? It happens to people like me. So I was, number one, I was embarrassed, and I was hoping and praying that when she saw me that my shirt was long enough to cover, the crotch part of the boxer shorts, and it was just the ends of the boxer shorts. But oh my gosh, rough. And I told my friend when I came to work, I'm like, yep, it happened. I missed getting my kid from school. Yeah. So, yeah, that was rough. Embarrassing too. Very embarrassing.
Yeah. Yeah. Well, and things that happen on day shift don't happen on, or night shift and night shift, day shift, vice versa.
It's totally different.
Yeah, it's totally different. Yeah, I had a similar thing when I couldn't fall asleep one day. Oh, I know. I came home and I'm like, usually I don't know what your routine is, but my routine is I go home, feed the animals, because I live on a farm, and it doesn't take that long. And then I dive into bed. That's it. It's the end of it.
Yeah.
Right? And then 4 o'clock, I'm up. This day I was like, nah, I think maybe I'll fix the gate, and spend some time doing the gate. But I think I had missed that window where I could actually really kind of relax. Plus my hip was hurting me and all this stuff and yada, yada. Anyway, and I'm like, I better take a Benadryl and lay down or something. And I couldn't fall asleep. And then when you can't fall asleep, it's like, oh my God, I can't fall asleep. And I have to work tonight.
Yeah. And that's like a fear too, I feel like, is like you want to get that quality sleep so you can feel good at night.
Yeah, right? And then you get in a loop and you can't get out of it. You're like, oh my God. And as you watch the clock, I'm like, oh my God, I'm going to be up all day and I'm going to be up all night.
Yeah.
And I was up last night too. So I finally fell asleep. It wasn't until like 2 o'clock. Now, mind you, I had to be up at 4. So I forgot to set the alarm. So my son, I hear him say, Mom, don't you have to go to work? I'm like, yeah, tonight. He's like, it's 10 o'clock. I'm like, in the morning? He's like, no, it's 10 o'clock. You better get out of bed. I'm like, what? He was like, no. I'm like, 10 o'clock. What? And I didn't know I still wasn't awake yet. So I get out of bed in my underwear. And I come out and I'm at the top of the stairs. And there's 2 sheriff's deputies at the door. And I'm like, what? And he's like, so he's in front of them, and he's like, what is, and I'm in my underwear. And I'm like, what is going on? And it's dark outside. And they're like, well, we had a welfare check because you didn't show up to work. So it was another county, and that jail, when I didn't show up to work, they called the neighboring county where I lived and said, can you check on her because she didn't show up to work? Well, and then they sent a couple of them, right? And I'm like, and the dogs are barking, and I'm standing there in my underwear, and I'm like, oh my God, it's 10 o'clock. So I was supposed to be there at 7 o'clock. And I called them. I'm like, I'm coming in. They're like, are you sure? I'm like, no, now I'm coming in. Well, oh my God, I came in. Everybody's crying. They thought I was dead, whatever. And I'm like, sound asleep, out, totally. So,
oh my goodness.
Yeah. It's craziness, I mean, I think also, just trying to manage. I mean, for you got to pick up kids. And I mean, I think that's pretty common.
It's rough because, I'll come home. Same thing with me. I'll feed my dog, feed the cat, let him out. And then I immediately relieve my babysitter, let her go home. And then I will start getting the kids' lunches packed, to get their water bottles, get them up, get them ready, brush their teeth. I mean, it's like herding cats, these kids. It's really rough. They're so tiny. And then I'll get them off to 2 separate schools, which, for any mom, that's rough as it is. So take them to school, and then I finally get to go to sleep. And then I'll sleep, and I have to get up in 4 hours to go get my oldest from his school. And I have to get in the car line because it's like miles long, it seems like. My gosh. And any parent, they know about the car line situation with how people get angry and they start honking and people cut each other. And every school's like that. It's rough. So not only am I tired from, that, I'm tired because I'm having to get my kids off to school and then pick them up. And then you come home and it's like you can't really go back to sleep because you got the kids home and they're wild, and they won't mind you half the time. So, and then you have to get ready to go do it all over again on nights. And like you and I just talked about, night shift is much, much different than day shift.
Yeah, it is. Yeah, I think that also, I don't find myself short-tempered at work, but I think when I get home, I'm like more short-tempered when I'm working night shift.
Yeah, I find that to be true too, because it's like my fuse is so short with the kids, and I know it's not me. It's just I'm so tired. You know, and a lot of times when I'm on my way to work, I'm driving and my eyes are burning. And I'm like, oh my God, my eyes are already burning. This is not going to be a good night, And then you think to yourself, how am I going to get through this night? And then a lot of times you just push through it and you start to get some kind of a burst of energy in there somewhere.
Yeah, it's coffee.
Hard. Yeah, coffee, soda for me, which is not good for you. But yeah, soda. But that's what gets you through it.
Yeah, it's just, it's a whole different world for sure.
Yeah, I had, just to change subjects here, but stay on the night shift subject. So I had a patient, we'll just call him Mr. Smith, okay? And I got a call on this floor where it's all single cells. And they call me, and they're like, hey, Nurse Bryan, we need you to come see this guy. He keeps banging his head. So I go down there with my blood pressure machine and all my supplies and everything, and they open up the cell, and I go in, and like I said, we'll call him Mr. Smith. So I'm like, Mr. Smith, why are you hitting your head? He's like, I'm just doing karate. And his head's got a little tiny abrasion on it. And the deputies were like, so Mr. Smith, are you going to stop this behavior? He's like, yeah, I'm done. I promise. I'm done doing karate for the night. I'm done. Well, I'm standing there, and my back's to the door, and I've got my blood pressure machine. And he goes, the detention deputy, he was like, all right, Mr. Smith, I'm going to ask you to do one thing when we leave this room. That turd that's on the floor behind the nurse, I'm going to need you to put that in the toilet and flush it when we get out. And I'm standing there like this, and I'm like, oh, my God, there's a turd behind me. There's a big old turd. And, those cells already smell a lot like a dirty hamster cage, as it is, because they don't flush their toilets, and it's disgusting. Yeah. But, yeah, that was a story that just happened not too long ago with Mr. Smith.
Well, people don't realize that jails run or prisons. Well, prisons not so much. They tend to go more to a little bit more skeleton staff, but jails and hospitals kind of run the same in terms of 24/7.
Oh, yeah.
You have some of the bigger jails. I mean, I can't imagine like Los Angeles jail or Cook County with 20,000 inmates, because you got to feed those people 3 times a day, round the clock.
Right.
You got to pass meds round the clock. So you probably almost have to have the same staffing on nights that you do on day shift.
Yeah.
In some of these places.
In some places, they'll have them take their showers at night, too. So they'll have a shower schedule, and they'll be like, hey, man, I want to come out for a shower. And I know on day shift, the difference there was, they have rec time. So they have to, and some people, if they're in a single cell, they'll have them go out for their rec time one by one. So they get their own personal time. Like usually it's about an hour is what they're allotted. So
yeah, in prison it's different. Prison, they're just in a rec yard. And one of the prisons I worked in, you had to pass everybody to get to work. So like you had to take the boulevard, they called it, to go all the way around to the medical department. So, but they weren't out in the middle of the night like that.
Yeah.
But I think that's when more of the shenanigans happen at night and weekends too.
It's like quality versus quantity a lot of times too. And then sometimes it's both. Depends, especially in intake.
Yeah. Yeah, intake is something. I was in a jail a couple of years ago. What did they say? They said, can you work, I don't know, like March 17th or something. Or I said, okay, fine, night shift. And I came in, and this jail I was like PRN. And anyway, I was working in booking. So they had a provider in booking. And I opened the door, and there were like at least 100 people waiting to be booked.
Oh my gosh.
Like normally you would have like 20.
Right.
And there were people on the ground. There were people on the chairs, people walking around. There was
nuts.
Right. There wasn't an empty seat anywhere. And I was like, what's going on here? And they said, well, St. Patrick's Day. I'm like,
you never thought about it.
I never thought about it. I'm like, and it was like the day after or something. It was after the bars closed.
Usually around like 2 or 3, right? That's usually when they start to really flow in.
Right. And I was like, oh my God. How am I going to get through all these people?
Gosh. Now, were you the only provider there?
Yeah, we had nurses. But some jails have nurses that do the intake, and some jails have CNAs or even correctional. I think I'd mentioned that. But the bigger jails have nursing staff. So they had 3 or 4 either RNs or LPNs, and then they had a provider doing the orders all the same time because all these people had to be detoxed.
Right.
Otherwise, you got to call all the time. So they had somebody 24/7.
That's good.
Well, yeah, you needed it.
Yeah, you have to.
If you have that many people being booked in on a night shift, there's no difference from the night shift versus the day shift.
Right.
So, yeah.
I remember I had this, I don't know why, in my thought in my head that when I was on day shift that, this is horrible, don't judge me. I thought that the night shift, nurses, providers were like the babysitters. They're just holding them over, kind of taking care of them, until the day shift comes on, like the real nurses, the real people. But I was so mistaken when I got on night shift. I was like, this is just as hard, if not harder, especially in intake, because it's chaotic. Like you were talking about how sometimes there's like over 100 people that need to be booked in, and all of those people have to be seen by a nurse or a provider, depending on what's going on with them. And that is hard. And they like to talk, and they like to tell you about their history. And you got to listen. You got to, a lot of times figure out what's real and what's not real. Because, my favorite is recently I had a patient come in, and he's like, ma'am, I really hurt my hand tonight. It's killing me. I got into an altercation. I cannot move my fingers. And I was like, all right. And so I made sure to, document it. I, make sure he could, feel my fingers touching him, and he's like, I can only wiggle these couple here, and these two I can't do nothing with them. And I'm like, all right, we'll get an X-ray order, we'll get you some pain medication, we'll monitor that. Well, he's in booking, like in the area to be seen by a nurse, I guess you would say, and he's being waited to be medically screened. And he is literally in there like, pulling his shirt around. He's like, oh, yeah, this, oh, yeah. And I'm like, wait a second. You just told me that you could not move these fingers here. And here you are, like, dancing in the, the room to be screened. It's just, you have to sift through the BS, basically. Right. And it's really hard because I feel like at the hospital, like most people, I would say, they try to be truthful what exactly is going on with them, where they're feeling pain, does it radiate, whatever. But in the jail, people are so manipulative and out to get pain medication or whatever, or go to the hospital just for a joyride, that you really have to do a good assessment. And, even when people think you're not watching them in the room, like waiting to be medically screened, we're watching. I don't think the inmates realize that.
Right, when they're scratching their head, and they said, you just said you couldn't bring your arm up.
Right, exactly. Like, oh, I can't, they'll tell me my arm can only go to right here. And then you'll see them in the room and they're like, I'm like, what are you doing? Yeah. So.
When I look at cases, I always look at, when I look at malpractice cases that I review, I always look at when did the incident happen? Mm-hmm. Was it night shift? Was it weekend? And I find I don't know what the percentage is, but a lot of them are weekends too. And not so much night shift, but more weekends tend to be more of a, I don't know. I mean, some places have lower staffing, I guess, on the weekend. I mean, it varies jail to jail, but you still gotta take care of them 24/7. So, I guess some people don't want to. I don't know. They don't want to work weekends, or they're Monday through Friday, or
it just depends.
Whatever else,
like you said.
Yeah.
I had this story that happened pretty recently. Call him Mr. Johnson. So he was also a single cell fella, and they call me and they're like, "Hey, we got to do vitals on this guy. He's not feeling good, whatever." So I take my vital signs machine, go down there to see him, and they were about to open the cell, and there's a glass on the top and a glass on the bottom, and there's like a little panel in the middle that kind of separates the two. And I asked the deputies, I kind of whispered, I'm like, "Hey, what is all that crap on the glass? Like, what is that?" And he's like, "It's what you think it is." And I was like, oh my God.
It's just, and we're going to talk about it in another podcast, our sense of humor versus normal people's sense of humor. Because I don't think we're normal.
No.
I think that we have and I think maybe even night shift is maybe even less normal.
Oh, yeah.
I don't know why, but I think they're a little bit more off than your regular human being.
Yeah, because when I was on day shift, I really thought those were my people. Before I went to night shift, they had this whole party for me, this going away party, basically. And they had an obituary with my picture on the front, and they're like, "In loving memory of day shift Nurse Bryan."
Yeah.
And I loved day shift, and I still do. But when I got to night shift, I was like, oh yeah, these are my people. And that's what makes it hard to go back to days ever.
Yeah.
Because I love my night shift people.
Yeah, but did anybody believe that you were dead?
Oh my gosh, it's my favorite. So I'm sitting in the back where you can't really see me, and they had all the obituaries just kind of laid out on the table. And one of our nurses,
for you,
for me, with my picture, in loving memory of Nurse Bryan.
What else did they have?
So inside of it, they had a whole itinerary. They're like, all right, so between this time and this time, we're going to sing songs. And between this time and this time, we're going to have the food. And they actually followed, even though we were working, they followed the whole itinerary for the day. It was cute. They were super sweet. And I'm in the back, and I hear this nurse come in, and she goes, what happened to Nurse Bryan? Because people really thought I died. They thought I died. Oh, God. It was great. I mean, it's not great. It's sad, but people believed it.
Yeah, but, and that's day shift.
That's day shift people.
Yeah. That's not even the night shift people.
Mm-hmm. They were cool people, really cool people to work with, and I made a lot of good friends and good relationships, too.
Yeah, but you get to the night shift, and they're even worse.
Yeah, sick sense of humor.
I was working, I went into, there's this little office. It's like really a closet, and it's got a computer. And nobody uses it really but me. Mm-hmm. And I went in to do a note or something, and the door just yanks open, and there's a nurse there. And she's like, oh, I didn't know there was anybody in here. I said, nobody comes in here. What? Why are you coming in here? And she said, I had to fart. She said I had to fart.
Oh my God. So she comes in your office?
No, it's the empty office.
Oh, the empty office.
No, I was sitting there.
Did she do it?
She's like, she's like, I can't believe you're in here.
That is so funny.
It's like, there's something.
That reminds me. So when I started working where I work now, my trainer was like, hey, don't fart in the elevators because they can hear you. Like the people that monitor the doors and whatever and let you in. And now, very mindful now. Because I'm like, oh my God, can you imagine? And then a lot of times they open, there's no one in the elevator and it opens up and you walk in and you're like, oh my God, someone just like their pants in here, literally. And I'm like, well, they heard you.
Yeah, probably turned up the volume.
Oh, it's so gross. And I think they do probably when there's just one person and they're like, they're going to do it. They crank up the volume. They're like, let's listen in.
Yeah, because we'll have to do a talk about it at some point. We don't have time right now. The next podcast, I'm like crying about cameras and how you can't, how everybody knows what you're doing.
At all times.
Yeah, at all. Well, maybe we'll continue that. We'll start on the next podcast. Well, we are already at 30 minutes.
Wow, that went by quick.
That went fast. So this is Off the Cuff. I am Dr. Minter.
And I'm Nurse Bryan.
And you can reach us at offthecuffnurses@gmail.com. Mm-hmm. We'll see you next time.
See you next time.